Hello everyone, welcome to BrainMindia. Today we are going to discuss about homeopathic treatment for schizophrenia. And for that purpose, we have in our studio a famous doctor, Dr. Jakir Hossain Laskar. Welcome to our studio, doctor. Today's topic is schizophrenia and homeopathic treatment for schizophrenia. So will you please elaborately say something about the homeopathic treatment of schizophrenia?
Actually, treatment of schizophrenia through homeopathy. So, sorry, I will discuss today my treatment protocol, BrainMindia homeopathy protocol, Neuro-Psychiatry homeopathy treatment protocol, which is exclusively mine, as I have been practicing neuropsychiatry for last 24 years, and I have seen several hundred patients of schizophrenia, OCD, depression, bipolar disorder, etc. So, gradually I will reveal some treatment protocols so that doctors across the globe, doctors across the nation get benefited. But initially, I want to make it clear that no one should encourage self-medication. Patients and the family members of the patients are requested not to give medications according to this protocol. So, as per your question, I can say that this schizophrenia is a chronic mental disorder, as you know, and it is characterized by delusions, auditory hallucinations, disorganized speech, and impaired mental functioning. And through this case study, I will explore how I treated this patient, this female patient, age 46. Her occupation is event manager. How I treated her within 12 months, and he got considerable satisfaction within this period, and she joined her profession gladly. So first of all, treatment patient profile is patient name, changed name, original name is not should not be disclosed. Patient name is Nikita Kulkarni. Her age is 46 years, gender female, occupation event manager. Initial symptoms which I registered, having listened from her, were auditory hallucinations, paranoid delusions, severe anxiety, disorganized thinking, and also social withdrawal. Okay. Patient withdraws from the social activity, society. So, how was the treatment protocol? First of all, my BrainMindia protocol combines three kinds of medications. One is constitutional medicine, one is therapeutic medicine, and one is trituration medicines. Combined with or within this framework, I treated this patient for her overall mental well-being. Constitutional medicines I prescribed. In my prescription, it was written that Stramonium 1M, I used this medicine, which targeted, which managed her severe mental conditions, managed her hallucinations and fear as well. Also, I used one more constitutional medicine. The name of the medicine is Hyoscyamus niger. I preferred to use 10M potency. It addressed symptoms of paranoia. It addressed symptoms of delusion, and patient got considerable improvement within a short span of time for her aggressive behavior. Next, I had to use, particularly for this female patient, some therapeutic medications. I used Helleborus niger mother tincture. What it does, Helleborus niger, as you know, it reduces confusion, it can improve memory and address lethargy, mental weariness, mental tiredness. So, when I used Helleborus niger along with Agaricus muscarius mother tincture, I got considerable improvement of various kind of symptoms within 2 to 3 months. Next, Agaricus muscarius, I used mother tincture potency to alleviate anxiety, to alleviate restlessness, and he had some sensory disturbances that also properly managed by this mother tincture Agaricus muscarius. As trituration, sometimes it is required to well manage the case. I used zinc cyanatum 3x potency, which improved cognitive functions, because schizophrenia is a disease. Patient experiences always some cognitive declines. So using zinc cyanatum 3x potency, I got improvement in her cognitive function, and also her mental fatigue was diminished within a short span of time. One more trisolution, lithium carbonicum 3x potency was administered. As you know, in homeopathic fraternity, doctors always know that lithium carbonicum is a great mood stabilizer. So in this female patient, I had to use lithium carbonicum 3x potency to stabilize her mood, to enhance her total emotional well-being. Now, I will disclose the total treatment timeline and progress. Initial phase, I took 0 to 2 months. During 2 months, what happened? Medications administered were stramonium 1M and Hosamas niger, 1 dose once a week alternately, along with Helleborus niger mother tincture and Agaricus muscarius mother tincture combined, 10 plus 10 drops with a little bit water twice a day for 2 months. And besides, I used zinc cyanatum 3x trisolution and lithium carbonicum 3x trisolution combinedly, 3 grain spoon once a day before retiring. These 3 kind of medicines were administered in the initial phase till 2 months. What I observed? My observations were the patient reported a noticeable reduction in the auditory hallucinations. She also said her paranoid symptoms has become less frequent and anxiety levels decreased considerably. Sometimes sleep patterns may be changed. In the case of schizophrenia, this patient, Madam Nikita, had the same sort of problem. She also expressed her satisfaction that her sleep pattern has been improved, and she has been observing it within 2 months. Now I had to go to intermediate phase for 5 months, 2 to 7 months treatment. Medicines administered were the same: constitution medicine, stramonium 1M and Hosamas niger 10M was administered as per initial stage. But in this stage, I skipped trisolutions. I didn't use zinc cyanatum 3x and lithium carbonicum 3x potency, but to well manage the severe symptoms, I had to use Helleborus niger mother tincture and Agaricus muscarius mother tincture combinedly, but I used it once a day, 10 plus 10 drops with a little bit water before retiring. My observation in this intermediate phase was, by the end of the 7th month, what I saw, patient expressed considerable improvement in her overall mental health. Her hallucinations and delusions were significantly diminished. She said she is feeling better in her cognitive function as well. Anxiety level was well managed accordingly, and patient resumed her profession again. So finally, her mood was also stabilized in the initial phase. So before going to the final stage, I stopped Helleborus niger mother tincture and Agaricus muscarius after 6 months. In the end, in the final phase, it took 8 to 12 months. After 12 months of administering medications, I used same medicines, constitutional medicines. Stramonium was dropped. I used only Hosamas niger 10M potency in the final phase, and I incorporated trisolution, zinc cyanatum 3x and lithium carbonicum 3x combined, 3 grain spoon once a day in the morning. And my observations were very optimistic. By the end of the treatment, this protocol having finished, patient expressed great satisfaction with the results in every respect. Patient expressed sustained movement. Her mental clarity was organized, emotional stability she received, and her social, all kinds of functionality were reinstated. Final evaluation in this BrainMindia protocol was that having finished treatment process, patient had no relapsation process, and patient's professional life was well managed. in the conclusion, I can say through this BrainMindia protocol, though it's a combination of constitutional, therapeutic, and traditional homeopathic medicines, it has proven effectiveness in the successful treatment of schizophrenia. And as this female patient expressed significant symptomatic relief, besides having all kind of cognitive improvements. So at large, you can say that homeopathy has good treatment procedure if it is administered by a qualified neurology homeopath. So finally, regarding this patient, I asked as a follow-up, I asked her that regular follow-up is required. I asked her to come after 3 months for post-treatment monitoring. And I asked her to have lifestyle modifications besides taking mental health care. And she is leading her life in great satisfaction.
Okay. So after listening all these things, I have a question in my mind, that is schizophrenia 100% curable?
Schizophrenia, actually, we have to think in 3 perspectives: mild stage, moderate stage, and severe stage.
Okay.
As per your question, in the severe stage, schizophrenia is not completely curable, but through homeopathic medications, it can be well managed within 10 to 12 months. But I can say, if the case is in the mild stage, when complete schizophrenia is not diagnosed, patient is in the condition of personality stage. That stage is named as schizoaffective personality disorder. In the long run, patient goes to the personality schizoaffective disorder, then schizophrenia, simple schizophrenia, then paranoid schizophrenia, heavy phrenic schizophrenia. Several kinds of schizophrenias are there. In general, today we are discussing schizophrenia, but subsequently I will discuss my treatment protocol on paranoid schizophrenia, heavy phrenic schizophrenia, various kinds of schizophrenias. So if the case is in mild or moderate stage, patient's condition symptoms can be well managed within 10 to 12 months. Considerable improvement is observed within 2 to 3 months. But as you said, as you asked, that in the condition of severity, patient has to be managed through medications and lifestyle modifications.
So in short, if patient comes at the early stage,
Yes.
then it can be cured 100%.
It can be well managed and maybe cured.
Okay, there is a question that you have to come early,
Yes.
then it can be managed and it can be cured. Anyway, we have got rays of hope against schizophrenia. We have got many information about the treatment of schizophrenia in homeopathy. And my last question is that you have described everything about the treatment and all, how to treat the patients, what will be the dosage, and everything you have discussed. What happens if somebody, after listening to your speech, if somebody starts the medication?
Start taking medications. No. In the starting of, during discussion starting, I talked about it already, that no patients or the family members of the patients are encouraged to take medications according to this BrainMindia protocol. This protocol may help doctors who have been practicing neurology and psychiatry across the nation or across the globe. They can be benefited, but patients are requested not to take medications, because self-medication is always harmful.
Okay. So this discussion is beneficial for the doctors,
Yes.
not for the patients, because self-medication is not.
Patients maybe can be aware that yes, there is a treatment, there is a ray of hope, as you said, in severe mental diseases like schizophrenia.
But they should not try it.
Yes, they must not try it.
Well, we have got lots of information about homeopathic treatment for schizophrenia. That's all for now. See you in the next video. Thank you.